Hi, this is Rebecca Frost, and I'm doing my postpartum assessment. The first thing I'm going to do is knock on the door and introduce myself. Hi, Mrs. Sloth. My name is Rebecca. I'm going to be your nurse today. I just need to do a quick assessment on you to see how you're doing after the baby. So after I've introduced myself, I'm going to perform hand hygiene. We're going to wear proper PPE, which in this case is going to be gloves because we may potentially come in contact with bodily fluids. Um, First, we're going to do a set of vital signs. We'll do blood pressure, pulse. We're going to check the respirations, especially if mom has had any narcotics. We want to make sure her respirations aren't too decreased. We're going to make sure her oxygen saturation is good. All that. Her blood pressure should be about the same as it was in pregnancy, if not a little bit lower. We're going to remind mom that she could have some orthostatic hypotension for a couple days. So when she gets up to go to the bathroom and to take care of baby, she wants to make sure she changes position slowly. Mrs. Sloth, I need to check out I need to look at your breasts to see if there's any abnormalities. Is that okay? She said it's fine. So Mrs. Sloth obviously doesn't have any breast, but if she did, we're going to be checking that the skin looks normal, there's no redness. We'll check to see if there's any warmth because we're assessing for potential mastitis. We're going to check the condition of her nipples. If there's scabs, bruising, any kind of abnormalities with your nipples where it looks like it's inflamed or hurting, we're going to ask her to call us the next time it's time for baby to feed so that we can help her make sure that baby is latching properly. And if she needs to, if we can't help her, then we'll make sure that the lactation consultant comes in and helps her with that because it's not a thing that comes naturally to most women. After we check her breast, we'll cover her back up because we only want to expose as much as possible. Then we're going to move down. We're going to listen for bowel sounds. We want to make sure they're active in all four quadrants because there's no reason why they shouldn't be active. We would also at some point listen to her lungs, and since we already have our stethoscope out, we can do it now. They should be clear to all. We want to make sure there's not any crackles, which would indicate fluid overload, because a lot of moms, either during labor or cesarean birth, will get IV fluids. So we want to make sure they didn't get too many. Next, we're going to check her uterus. We're going to check midline first. We're going to support I know you can't see this. I'm trying to get it to where you can see. Okay. We're going to support the uterus at the bottom so that way when we're doing our fundal massage and check, we're not causing any inadvertent prolapses or anything of the sort. We'll start it where it should be. It should be at the umbilicus, and we'll just kind of feel in there. It should be midline if everything's normal. If it's deviated to one side or the other, the first thing we want to check is when was the last time mom used the restroom and has she been able to urinate. If it's been a while, then we're going to go ahead and cover her back up, assist her to the restroom, make sure that she urinates like normal, and then we'll come back to the bed and we'll start the fundal check again, because if the bladder is distended, it could affect the fundus firming up and it could affect where it lies in the stomach. So hopefully that will fix our problem. If that doesn't fix our problem, then we probably need to notify the physician and see what else we need to do. So when we're checking our fundus, massaging here, like I said, it should be at the umbilicus or lower. We're checking to see if it's firm or soft. If it's soft, we need to massage it some, and if we do massage it and it firms up, then okay, we're going to chart that it's firm with massage. If it's firm, we're going to chart that it's firm. If it's boggy, then that's when we need to do some further interventions. Firstly, notifying the MD and letting him know, because that's potential for possible hemorrhage. Um, Next, we're going to look at mom's pad. So we're going to let her know what we're doing. We're going to open it up. We're going to look. The first thing we're going to ask her is when was the last time she changed her pad. She should be doing that every 2 to 3 hours whenever she uses the restroom. We're going to note the lochia. Is it locally? It should be, if we're still in the hospital setting, it should be lochia rubra because most moms are only there for a couple days. And in the first couple days, it should be lochia rubra. Then we're going to note the amount. Is it scant, which would be just a small amount? Is it moderate, which would be, maybe like a third to half of the pad? Or is it a lot? If it is, then we're going to have mom get up, change her pad, and then we'll come back and check her frequently to make sure that we're not soaking that pad in an hour or two, because that's an indication of hemorrhage. We're also going to check mom's perineal area. Sorry about my cat. She thinks that everything on the bed is her business. We're also going to check mom's perineal area. If she had any lacerations or if she had any episiotomies, we're going to look and we're going to see, is it, lay down. We're going to look and we're going to check RETA, which is redness, ecchymosis, edema, discharge, and approximation. In the first day or two, there probably is going to be some redness, maybe some slight bruising, potentially some swelling. That should fade in a couple days. We're also going to look at the incision, if there is one, and make sure it's well approximated. There should not be any discharge. If there is discharge, then we need to address that because that could be an indication of infection. Then what else? Then we're going to check her legs. The bubble heat format says to check the Homan sign, which to do that, you'd have mom relax her legs. You'd support under her knee, and you'd go up rapidly. Lucy, lay down, love. You go up rapidly and ask mom if she had any sharp pain in her calves. Most of the time the physician does that. We don't do that, but that is how it would be performed. And you're going to check her legs for any red spots, any warmth, any spots that are like potentially more swollen than the others. You're going to ask mom if she has full sensation in her feet. You're going to check pedal pulses. All those things will be indications of DVTs. Some women don't have any indications of DVTs, but because it's a postpartum woman, we are at high risk of DVTs and blood clots. That's it for her legs. The next we're going to check is just her energy and her emotion level. Is she able to get up and go to the bathroom? Is she wanting to? When baby cries, is she getting up and going to check on them? How is she bonding with the baby? How is she with her family members that are in the room? Or does she have any family members in the room? You're going to want to note how she is with the baby. Is she bonding with the baby? Is she going, oh, baby looks like grandpa, or baby looks like grandma, or my sister? Is she being loving towards it? Is she taking care of its needs? Like, if baby's acting like it's hungry, like it's, no ma'am, then she's going to want, no, wait. I'm sorry about that. My daughter was trying to do something, and I don't know what. Well, we were checking emotional level. We're going to want to make sure that she's taking care of the baby, make sure she has a support system. How is the support system? Is the relationship friendly? Is it supportive? Or is it like indifferent? Or does she seem like she might be in danger? All these things are important because they're important for what mom and baby's life is going to be like going forward when they leave the hospital. This is also a good time to start discharge teaching. Just anything that you see that you can educate on, go ahead and educate now. Ask questions so that you can prepare for mom and baby to have the most successful discharge ever. I think that I covered everything. You're also going to want to ask about pain. I did forget about that during your assessment, because mom should have a moderate amount of pain, but not severe. Um, if she does have pain, then you're going to want to figure out how you can address that, whether it's pain in her perineal area and you're going to maybe provide an ice pack or some Tux pad, or whether it's, incisional pain from a cesarean, and then you can give her whatever the prescribed medications are. I think I also forgot that when you introduce yourself and you explain what you're going to do, you're also going to want to identify mom with 2 identifiers. You're also going to, if baby's in the room, you're going to match mom's bracelet and baby's bracelet along with any other support person that's in the room. And that's for security purposes. And I think that that's it. Thank you.